This is a quick yin yoga practice for my friends who suffer from low back pain. We will be looking at expanding your movement diet for more resilience in your back. For your practice, all you really need is a blanket. Some might like an extra blanket or even a pillow for resting your head on. When you're ready, I'm going to have you come to all fours. And as you come to all fours, go ahead and bring yourself more to the back half of your mat. Bring your big toes together and your knees pretty wide, wider than your hips if you don't mind. If your knees get tender on the floor, just open up that blanket. That can go under your knees. And start to bring your hips back toward your heels. No need to push. Just see how far back you can go. And when you find a comfortable place, come down to your elbows. For some, resting the forehead on your folded hands is a comfortable option. For others, you may need to even have your hands fisted up and you can rest your forehead a little higher. You could also use a block under your forehead. And for others, it's more than comfortable to bring the forehead all the way to the mat. I'm going to have you with your elbows a little wide out toward those long edges of your mat, which means that your big thumbs could come together, almost touching. Because we're working with the back today, not necessarily the shoulders, we don't need to reach those arms all the way out. Sometimes you just need to keep it simple. And once you've found that child's pose, I'm going to have you begin to connect with your breath here. Notice any movements that occur along that spinal column as you're breathing. Or is the spine perfectly still, completely stiff? You may notice as you're breathing in and out that the expansion of your breath is sort of into the low abdomen, or maybe it's higher into the chest or wider into the ribs. Take a few breaths now to explore the different options. So if you were breathing more into your low abdomen, maybe you're going to try breathing higher. If you were breathing higher, maybe you'll breathe wider. And I wonder if you can notice if the different breathing options facilitate a different experience of the spinal column. Or is everything exactly the same regardless? And let's just take one more breath in your child's pose. And then come back up to your elbows. And then to your palms, finding a tabletop position. And from this tabletop, keep your right knee pretty wide, but slide your blanket out to the left. So it's just past the left long edge of your mat, adjacent to your left knee, okay? And then lean the weight to the right and bring the left knee and ankle out onto the blanket, which you've just set there. Slide your right knee back in space and your left knee straight out, coming to a half frog position. So left knee, slide it even a little bit further out, and you'll notice that your right thigh is turning out now. Your right knee is turning out. Your left knee is pointed outward. This is pretty intense. So if having the legs that wide is too much for you, just bring your right leg in a little bit closer to your left leg. And then once you've got everything settled and you're happy with your position, come on down and rest on your right cheek. So you could fold up your hands for resting your cheek, or your cheek could rest directly on your mat, or maybe here's where you pull up that pillow or that extra blanket for under your temple. And come back to noticing how the breath is impacting the experience of the spinal column. You might notice that it's kind of hard to breathe into your lower abdomen now. So what about breathing now into your back body instead? You might notice that when you breathe in, things get kind of stiff. Maybe you feel your lumbar rise up to the ceiling slightly. But when you breathe out, it's the opposite. There's a lack of stiffness. There's a softness there, and maybe the lumbar sinks toward the mat. For many of my clients with back pain, that movement of allowing the spine to sink is distinctly threatening. It feels a little dangerous. Most of my clients with low back pain would prefer to have their pelvis tucked most of the time. This is kind of like a security blanket in the body. But today we're building spinal resilience by recovering some movements, maybe that we have felt were threatening in the past. So keep the breath really gentle and soft. And if you're feeling a little nervous, you can make your breath even softer, so the movement is milder. Let's just take one more breath in the half frog like this. And then I'm going to have you actually keep your legs as they are, but come up onto your two elbows. So your upper body looks like it's in a sphinx position, with the elbows not directly under the shoulders, but just slightly more forward of the shoulders. You're welcome to clasp your hands as well, if you'd like. Now, one thing I'd like for you to be aware of is if the elbows are too close to the ribs, this is not very comfortable. In fact, it's nearly impossible. So make sure your elbows come forward a little bit. And take a soft in, and then a very releasing out, feeling that lumbar soften toward the floor. One more time, a soft in. And a releasing, a letting go on the out as you turn your gaze, your eyes, your nose toward your right foot. So that's your extended right leg behind you. Look back at your foot. And then bring your gaze forward again. Your ribs, your nose. Let's try that again. So you're going to turn your gaze, turn your head towards your right foot and notice any sensations in your spine. And come back to the center. I'd like for you to try something different this time. So it's going to be the same basic action, but initiate by pressing your left ribs to the left. And see what happens when your left ribs poke to the left. And then come back to the center. Maybe it's a little more intense, right? Because we've just recovered a little bit of extra movement, right? A little vertebral shift. Let's try that again. Left ribs move left to turn the gaze and the face to the right. And then come back to the center. This time, what if the right ribs move to the left as you turn your gaze to the right and look back at your right foot? That might even be a little more intense. Let's try that again. Right ribs move to the left to turn the gaze to the right foot and then return everything to the center. What if we try it with the hips? How's about allow your left hip to draw downward in space. You're going to feel a lot more sensation in your left hip. And then allow that left hip to return to neutral as you turn your gaze forward, your chest as well. That's a hard one. Try it again. Left hip moves back and down to turn your gaze to the right. And then left hip lifts back up to neutral as the gaze is neutral. What about the right hip? Can the right hip lift towards your right armpit? And then right hip return to neutral as you come back to the center. That one's kind of weird, isn't it? Right hip lift toward the armpit. And then return to neutral. Then hold. Just take a breath. Once again, softening the spine. Now walk 2 elbows to the left. Right? Maybe even off of your mat a little bit. And then lay your head down on your right arm and swing this right leg, which was extended, swing it to the left as well. So pretty much everything is to the left side of your mat now, except your hips, which are kind of in the middle. Yeah. And then use your left hand, press down into the floor and roll yourself onto your right side. Cross your right ankle over your left ankle. Yeah, your hips may want to shift a little bit more to the right, or maybe they can stay as they are. As you roll all the way open, bring your left butt cheek all the way to the floor. Your ankles are crossed and to the right, and your upper body, head and shoulders are also to the right. This is what we call the banana asana, because you're in the shape of a banana, okay? So your hips are a little further left, your ankles, your shoulder, and your head are to the right. And for the arms, let's just reach them straight out to the sides. Let your head gently tilt to the right. Now sometimes, especially on this side, the right side lumbar, or the SIJ, if you're familiar with that joint, gets a little tweaky. So my suggestion for you is to make sure your right butt cheek is a little bit wider so that it can relax. Because if your right butt cheek is clenched, this is not going to be that fun for you. And of course, your position may be too intense. Maybe you need to make it milder for yourself. And let's see. Once again, we're going to look down toward the feet, not with the eyes, but with your right side collarbone. Pretend your right side collarbone has eyes looking down toward your 2 feet, down to the right. And then do that, relax for a moment, and then do that again. So we're kind of side bending a little extra. Do you feel that? Just initiating with the collarbone. What if we bring it back to the ribs? So let your left side ribs poke to the left. And then just relax. So you're moving a tiny, tiny bit. Think about one of the ribs right in the middle on the left. So not at the bottom, not at the top. Locate that rib in your mind's eye and see if you can poke that rib specifically, and all the others will come with it, to the left. A little more. Relax. Go up 2 ribs, up towards your armpit, and then poke that rib more. So we're adding a lot of vertebral options here. The movement is so, so mild, yogi. I want you to know that I always advocate for milder movement because I am a huge consumer of movement science, and I don't see anything that indicates that a bigger sensation, a deeper stretch is actually better for you or more productive. It's quite the opposite, actually. So explore maybe even 1 vertebra higher. 1 vertebra higher. Just kind of working these options in. Good. And then I'm going to actually have you rest. So come back to that position where you feel rested. Maybe your head finds a different position as well. Instead of turn to the right, maybe you look up. And just breathe. Just like before, we have lots of options for the breath. We could breathe more into the low abdomen. We could breathe high into the chest, feeling those collarbones lift. We could breathe wide into the ribs or into the back body. One thing that we know is that individuals who have low back pain often feel as if their back is unstable. But what we see in the research is that this is actually not true. Typically, when someone's had back pain for a while, it's the opposite. Their entire trunk becomes very stiff. Maybe initially it becomes stiff because they're holding their abs tight, right? They're holding their breath. They're engaging their paraspinal muscles in order to feel a little relief or to feel a little safer. But over time, the nervous system actually takes it on as its role to keep those tissues engaged, right? So you'll have this guarding, this hypertonicity in these tissues now, even though the tissues themselves are no longer in danger. So it's not that we're unstable when we have back pain. The opposite is true. Sometimes we're too stiff. And so this practice is about recovering those movements. Let's take one more breath in banana. And then bring your left arm just across your body. Just rest it on you as you roll back onto your right side, drawing your knees up towards your chest. Take a breath. That's an intense pose, that banana. So if you had to take breaks, it's totally fine. And then I'm going to have you roll into your hands and come all the way back to a tabletop position. All the way back to a tabletop position. And I'd like for you to just allow your spine to soften toward the floor on the out breath. Let it soften. And then inhale with your spine still in that arched position, the cow-shaped spine. Breathe in. And then breathe out. Soften again. So this is the movement that I have found my clients are most worried about. This extension. This movement for many has become off limits. So on your next exhale, let your spine round, let your tail tuck. This movement, on the other hand, is the one that seems to be a comfort zone. Maybe you feel that right now. This feels more like home. And then soften once again. Allow the spine to sink toward the floor. Just take a breath in and out here. Then arch. And then round. Take a breath here in that rounded shape back to home base. So if you feel safe here, my goal is not to take that away from you. Not at all. I just want to reintroduce a few options. So we're going to take that blanket. And it is going to move to the right now. So it's just off to the right side of your mat, and it's just adjacent to your right knee. And then take your right knee and ankle out onto that blanket. Slide your left knee back and your right knee out to the right for the half frog, this time on the right side. Slide that right knee just as far away as it'll go. So you're kind of rolled more to the inside of your left thigh. Although if that's too intense, you could for sure be on the front of your left thigh, bringing that left thigh a little narrower. And then go ahead and come down and rest on your left cheek. Let your arms just come to any comfortable position and take a few breaths here just to explore. So this practice is not just about moving the spine. It's also about the experience that you're having as you move your spine. So if your experience is one of fear, if there's a lack of trust, that is your experience. That is embedded in the movement itself. So see if here you can just find a calm breath. Mentally reminding yourself that it's safe to move your back. And you'll come back to the Sphinx now. So bring your elbows in, prop yourself up on those elbows. Now remember, we can't have the elbows under you because that's just horribly uncomfortable, right? So bring them far enough forward that your heart is lifted and your collarbones are wide. Just a light pressure down into those elbows. And then turn your gaze, look at your left foot with your eyes. And then come back and look forward. This time, poke your right ribs to the right as you look at your foot. I wonder if you got any further. If it was more comfortable for you. Do that again. Poke your right ribs to the right. To look at your left foot and then come back to the center. Now poke your left ribs to the right. Oh, so much happening there, right? So sometimes we say, okay, I need to recover movement. I need to move more. Maybe that isn't quite the attitude, though, that will be helpful. In fact, what we see in the research is that we really need a sense of playfulness, and we need a task. Our brain loves a task. This time, try this. Lift your right hip up towards your armpit to look at your left foot. And then pull your right hip down in space to come back to neutral. Lift your right hip up to look at your left foot. That might be intense in your thigh as well. And this time, bring your left hip down to look at your foot. And then bring it back up to return. Last time. Okay, great job. Hang out here in the Sphinx with your heart forward. And then walk both elbows a little bit more to the right, maybe even slightly off of the mat, so that you can come down onto your left side and just rest your head on your left arm for a moment. And then push down into your right hand. Your head moves off of your arm so you can start to roll towards your back. Bring your left ankle more to the left. So that was the extended leg. It goes more to the left, and then cross your right ankle over your left. So as you roll all the way open, your right butt cheek comes to the floor. Your head and shoulders are probably more to the left because of the position that we've just left, and so are your ankles. Arms are straight out to the sides for your banana, which for most of us feels like a big side bend on the right. And if it's a little tweaky, remember, you could do that little trick where you widen your left glute and then soften it. Notice that you could breathe in any number of ways. Another option, too, would be to simply hold the breath. I'm not saying that's the best option, but that seems to be one that is well executed by most people who have back pain, right? So we hold the breath to maintain this interabdominal pressure, this sense of the spine feeling less compressed. And while it may help you to feel like your spine is a little less compressed for a moment, it also really ramps up your fight or flight system. So that part of your nervous system which responds to danger. And you've already been fighting this experience of feeling that you're not safe, right? If your back has been hurting, you're probably not feeling terribly safe. Holding your breath is not helping. That's just amplifying that danger experience. So use your breath now to promote a sense of safety in yourself, in your back. And then begin to locate a rib on your right, somewhere in the middle. Somewhere in the middle. And then poke that right rib a little bit more to the right. And then relax. And then find the same rib but on the left and poke it to the right. So it's not going to the left, it's also going to the right. And the movement is going to be tiny. So when you return to center, it's almost like you didn't hardly go anywhere, right? Find a slightly higher rib, maybe one or two higher, and poke to the right. Try that on both sides, right and left. Again, use that breath to promote a sense of safety in you. These movements are safe for me. Because as much as we might want to keep the spine stiff for the rest of our lives to avoid the potential of pain, if you have back pain, you know that's not really helping. That's number one. And number two, the world is not that kind, right? The world is not going to facilitate you keeping your back stiff and straight all the time. The world will require that you move your back in any number of ways, especially if you want to have a really full life, a rich diet of movement. And then let's just take a few breaths in stillness. No need to press with the ribs, either on the right or the left. Just breathe. Let your head find a position which feels neutral for you. And then please roll back over onto your left side. Draw your knees up toward your chest. And then roll back again into your hands and up to your tabletop. Up to your tabletop. This time, bring your two knees together. Bring your ankles together, your big toes. And then slide your rear end back towards your heels any amount. Maybe your hips don't rest on your heels. Guess what? Mine don't either. Bring your forehead down to rest. Could be on the hands, could be the fists, could be the floor. And most of us feel a little more compromised in this position, especially if you've got a nice belly. Maybe it's hard to have your belly pressing against your thighs. You're welcome to have your knees wider. But keep this rounded spine. Elbows are certainly resting on the floor, probably wide. I like to have my thumbs together. And then please come back to your elbows. And just elbow walk yourself out onto your belly. All the way out onto your belly. And once you're there, slide your arms out in front of you and bring your forehead down. Now, if your forehead is way away from the floor, put your blanket under your forehead because I want your forehead resting on something, okay? Arms are stretched out in front of you. And I'd like for you to tuck your tail now. So draw your tail down toward the floor. You might feel like your glutes engage and your lumbar flattens out. Notice any feelings of stiffness. And then do the opposite. Let your tail lift up. Your lumbar soften toward the mat. No pressing. And then press your tail down. Let your tail lift. And by the way, this movement is very mild. Very mild. I think that a lot of my clients have been told by someone that it's probably safer for them to have their tail tucked. There is no evidence that this is the case, not at all. In fact, if you really want to get down to brass tacks, having your sacrum in a more neutral position, so not tucked, but sort of in between tucked and lifting your tail, that is actually the most stable position. So we've worked a little bit into the lumbar, we worked a little bit into the thoracic spine. This is in the sacral area now. Let's do 2 more. Just exploring our movement options all along the spinal column. And then find the position which for you feels like home, feels neutral now. Maybe it's changed. Now please lift your head, come up to your elbows. Walk your elbows to one side, but this time it's because you're going to roll all the way onto your back. All the way onto your back in that blanket. Maybe you can slide that around for something to rest your head on. If it's more comfortable for you to have your feet flat so that your lumbar can be a little bit more down toward the floor, you totally have my blessing to maintain that position. But if you'd feel more rested if your legs were extended out long, go ahead and do that. Another option, if you're looking for something in between, is just to place something under the thighs. A pillow, if you have a yoga bolster, you could use that, or even another rolled up blanket. That can kind of be an in-between for you. Let your arms just rest in a comfortable position and take a few moments now to explore your breathing options in this position. So does it feel better to breathe wide, to breathe into the back, to breathe into the abdomen or the chest? Or maybe you'd like to breathe into all places at once. Now, yogi, I'd like to invite you to stay in this position for as long as you're able today. So maybe you have another few breaths, or maybe you have another few minutes. Thank you so much for practicing with me. Namaste.